Hey everyone, welcome back to all my listeners. This is episode 14 in season 15. Today is Wednesday, August 6th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, so welcome to another brand new month. It is the month of August, and it is going to be a scorcher. I know our temperatures here in the Midwest are expected to be in the upper 90s once again for the next several days, and the air quality here is quite terrible because of all of those atmospheric disturbances, the Canadian wildfires that are steeping down into our upper atmosphere levels here. There is also a Rocky Mountain wildfire that should be approaching our atmosphere here next week. So just a lot of hot weather and air quality disturbances. So it's not really fun to take that morning walk outside because the air quality is just quite stifling. So anyway, I hope you guys are escaping the heat by jumping into that pool, heading to your lakeside houses, or taking that vacation and seeing some ocean, either Atlantic or Pacific, or even somewhere international. Hope you guys are enjoying the last moments of summer. All right, you guys, today's episode is going to be short and sweet. I wanted to put my spotlight again on Newsworthy for a healthcare awareness month for children's eye health and safety. And in my Trusty tip, I wanted to focus on the latest evaluation and management frequently asked questions update. And I'm going to go ahead and close out and round out today's episode with another remarkable quote on hopes and aspirations by Maya Angelou. All right, you guys, let's get into it. So in today's Newsworthy, August is Children's Eye Health and Safety Month. Prevent Blindness is the nation's leading patient advocacy organization dedicated to preventing blindness and preserving sight, and they have declared August as Children's Eye Health and Safety Month. Uncorrected vision problems can impair child development, interfere with learning, and even lead to permanent vision loss. Now, according to Prevent Blindness Children's Vision Health Map, vision issues in children are common in the United States, and they based all of their research and data from the Centers for Disease Control and Prevention's Vision and Eye Health Surveillance System. 1 out of every 122 children has permanent vision loss. There are 25% more girls with vision loss than boys. 1 out of every 45 children in Medicaid had an amblyopia, also called lazy eye, or strabismus, also called eye misalignment, diagnoses in the year 2019. This includes 1 out of every 94 children with amblyopia and 1 out of every 70 children with strabismus. Among the community-level indicators included in the Prevent Blindness Children's Vision Health Map, vision loss is most closely correlated with the prevalence of children in poverty, upwards of 55%. Nearly 4 million children in Medicaid received at least one pair of covered eyeglasses in 2019. Preventing eye injuries is a critical way to prevent vision loss in children. Dedicated resources on safety and eye protection, including contact lenses, sports, UV, screen time and digital services, and home and toy eye safety are also available. Now, I'm going to be posting a link in my show notes on this important health awareness month, so be sure to check it out. And now it's time for my best practice tips in Trusty Tip. All right, so NGS, that's National Government Services, that's a MAC here in my region. They've made another frequently asked questions or FAQ update for a number of evaluation and management code sets. Now, based on the everyday auditing that I see, I wanted to go over a few really good tips. Like for time, if you're using time to select your evaluation and management code, again, for the office place of service. Now, first of all, the time range is gone with the new guidelines, and I'm continuing to see documentation that just misses the mark. So, my goodness, right? I continue to see the time ranges, and I'm just in shock because it is 2025. right? And those time ranges went away with the new guidelines. Or the billed claim that was sent out to the payer, the wrong code was billed based on those time designations from prior to 2021 and 2023 guidance. So I continue to see time documented that does not apply to this current evaluation and management standard, again from 2021, and then updates made in 2023. So now I was so happy. I know you guys have heard me say this over the years on the podcast or in education that I provide from national webinars that I deliver, but I was so happy to be done with these 1995 and 1997 guidelines from the past. But I'm still haunted by the outdated documentation style templates and outdated EMR systems. Like I said, I'm auditing every single day, and I continue to see time that is used incorrectly in documentation, and therefore the codes that are chosen on billed claims going out the door are incorrect. So remember, a straightforward evaluation and management code, again, is 99212, and that time is 10 minutes of time. There is no time range. It is 10 minutes of time must be met or exceeded to report CPT code 99212. Now, another example, a low evaluation and management at 99213. If you're going to use it for time, it is for 20 minutes of time. Again, there's no time range there. It is 20 minutes of time must be met or exceeded. Now, another evaluation and management code, a moderate E&M at a 99214, if you choose to use it based on time, is for 30 minutes of time. Again, there is no time range, but that 30 minutes must be met or exceeded. And finally, a high evaluation and management code at 99215, if you're using time, is for 40 minutes of time. There's no time range there. It is 40 minutes of time must be met or exceeded. And of course, our payers want to see the time documented and coded correctly based on the date of service. Payers may also include details in their own evaluation and management policies that they need to see in documentation based on the AMA's requirements for choosing time for E&M office visits, for example. So you've got to be mindful to not only the AMA's CPT code definitions and explanations, but your payers might also have carved out a specific policy for evaluation and management code sets. So you have to dig deeper and do the research. Now, these particular codes can also include both face-to-face and non-face-to-face services when you are documenting that time in the note. So those are going to be used to determine the appropriate level of service. Again, in the new standards, right, you can include both face-to-face time as well as your off time, right, when you're not face-to-face with the patient in that exam room. Now, the AMA and the CPT codebook go into those specific activities that you can include in your documentation to support those time calculations. And those include preparing to see the patient, obtaining and or reviewing history, performing the examination, counseling and educating, ordering tests or medications, communicating with other professionals, documenting clinical information, interpreting results, and care coordination. So be mindful to include a little bit more detail other than just the time being documented in that EMR system, again, based on the new standards for evaluation and management code sets. Now, let's move on. NGS also made an update for something that I see consistently in substance abuse treatment services that I thought my audience could find useful. Now, the question that came in is, when is it appropriate to bill CPT code 99211? And can this be used for medication renewals? Does it require the physician or a APRN to be present? Does the patient need to be present? i.e., can that service be provided via telephone? Are there time duration limitations? Now, NGS, of course, kindly provides their feedback, their answer. And they say, quote, CPT code 99211 represents a patient service that does not require the physician's direct interaction, but must meet the Incident 2 requirements for physician's presence in the office suite. For example, this code may be appropriate for medication renewals if there is documented interaction by clinical staff with the patient regarding the medication, but does not represent the patient coming into the office to pick up a new prescription at the reception desk. The patient has to be present in the office, and telephone services are excluded. As of January 1st, 2021, the time component has been removed from this code. And remember, when I was just, for example, quoting to you those established office patient codes, I only started at 99212 a moment ago based on time requirements, right? Because there is no time component for this CPT code 99211 as of January 1st, 2021. All right, so let's move on. Finally, for the mental and behavioral health evaluation and management services section, especially those via telehealth, I know I've said this again and again and again on the podcast and other places. So I thought this was really going to be useful to include once again. So NGS has updated the FAQ with another question and answer. And the question that came in was, please define technology requirements for providers who perform telehealth mental health services for beneficiaries at home. Now, the answer NGS provides is, quote, providers who perform such services must have access and capability to use interactive telecommunication technology that includes both audio and visual, two-way, real-time communication capability. Exceptions to this rule are based on the beneficiary's capability and agreement as follows. Number one, the beneficiary may not be capable of audio-video communication, or the beneficiary may not consent to audio-video communication. In either of these circumstances, the provider must provide documentation in the patient's medical record, end quote. And I love that. We have to make sure that we're including that rationale in the patient's documentation when these types of telehealth services are involved. So the patient has to consent to it. And if they do not consent to it, that has to be documented as well. Again, the Medicare patient simply doesn't have the technology, right? They don't have the iPad. They don't have a laptop. They don't have the capability of audio video communication, or they simply do not consent to being on video audio platforms. So again, we have to be mindful. I've seen tons of documentation that is still lacking on that point currently in 2025. And finally, I focus season 15 Spark on hopes and aspirations. I want this 15th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires us with their statements involving hopes and aspirations. So in this week's inspiring quote in Spark is from Maya Angelou. You may trod me in the very dirt, but still, like dust, I'll rise. Absolutely true, right? This quote reminds us, no matter how downtrodden we feel, no matter how others may push us down and try to keep us small, we can remember these wise words. But still, like dust, I'll rise. Maya Angelou inspires us to keep rising to our greatest aspirations. I'm happy her spark burns brightly and inspires so very many. All right, you guys, that wraps up today's short and sweet episode. I hope you enjoyed it. I especially loved those FAQ questions that came in. And again, they're so very poignant in the everyday work I perform from a auditing and compliance perspective. So I hope you guys got a lot of takeaways there. All right, you guys, I wish you all a very, very happy and incredible week ahead. Thank you so much for listening to today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.